Welcome. If you're getting ready for the next generation NCLEX, you know it's a whole new ballgame. In this explainer, we're going to break down the single most important skill you need to master, not just to pass, but to excel. You've probably heard this quote 1,000 times, right? But what does it actually mean? It means the exam has shifted from just asking you to remember facts to testing something much deeper, your clinical judgment. It's about how you make decisions when the pressure's on.
So why this huge change? Well, the people who make the exam, the NCSBN, took a hard look at modern nursing. It's complex, it's fast-paced, and they realized they needed to be sure that new nurses are truly ready for it. It's not just about what's in the textbook anymore, it's about your critical thinking skills. And that brings us to the core concept: clinical judgment. I mean, look at this definition. It sounds a bit academic, but all it really means is connecting the dots. You take all the pieces of the puzzle, the lab results, the vital signs, what the patient is telling you, and you put them together to see the big picture and make the right call. It's what makes a truly great nurse. Now, I know you spent years drilling ADPi, the nursing process, into your brain. And here's the good news. All that hard work is not going to waste. We're not throwing it out. Think of it more like we're giving it a major upgrade. What we see here is how your trusty ADPIE framework evolves into what's called the Clinical Judgment Measurement Model, or CJMM. You can see how each step you already know, assessment, diagnosis, planning, and so on, maps directly onto these 6 new cognitive skills. It's a logical next step that shows how an expert nurse thinks.
And right here, this is the crucial difference. In the old way of thinking, assessment was just about collecting data. Now, with recognized cues, you're doing that and immediately asking yourself, okay, out of all this information, what actually matters right now? It's a huge mental shift from being a data collector to being a data interpreter.
All right, enough theory. Let's get our hands dirty and see how this actually plays out. We're going to run through a quick case study, an NGN-style question, so you can see these 6 steps in action.
Remember, these 6 steps are like your GPS for clinical thinking. They form a continuous loop that will guide you through any patient scenario, from the exam room to the bedside.
Okay, let's do this. Here's our patient, a 72-year-old man with pneumonia. Take a look at all the data on the screen. What jumps out at you? I mean, really, what are the pieces of information here that make you say, I need to pay attention to that? This is step 1, recognize cues.
If you honed in on that low oxygen saturation and the high respiratory rate, you are spot on. Think about it. The patient has pneumonia. That's a lung problem. So any data related to his breathing is going to be your most important cue.
So we have our cues. Now we move to steps 2 and 3. Analyze cues and prioritize hypotheses. We know the core problem is respiratory. We know the most significant cues are the low O2 and high respiratory rate. So what's our working theory? The patient is in respiratory compromise. That's our number 1 problem.
And that, of course, leads us right to the correct answer. We have to prioritize what's going to harm the patient the fastest. In this case, it's absolutely his breathing. Everything else can wait a minute.
And let's talk about why the other options are wrong, or at least not the first priority. Sure, the high heart rate, the fever, the warm skin, those are all important signs of infection. But are they as immediately life-threatening as not being able to breathe properly? No way. Same thing goes for the low blood pressure and dizziness. Those are serious, for sure. They point to a circulation problem. But you have to remember the golden rule: airway, breathing, circulation. In that order. Always. We have to fix the B before we can get to the C. You see? That whole simulation, it all boils down to one thing: prioritization. And at its core, prioritization is all about patient safety. It's about looking at a complex situation with a dozen problems and knowing instinctively which one you have to tackle first.
To get really good at this, you need to become a red flag detector. You're constantly scanning for those signs, those subtle cues that scream danger. These are the things that tell you to stop what you're doing and act now.
And here are some of the big ones. A sudden change in mental status? That's a massive red flag. A patient who was perfectly clear an hour ago and is now confused could be hypoxic. Restlessness can be an early sign of low oxygen. Recognizing these things early is what saves lives.
And if you ever feel lost, if you have a question with 4 seemingly correct answers, always, always, always come back to this. ABC, airway, breathing, circulation. This is your ultimate safety net. It's your compass that will always point you in the right direction. Master this, and you'll nail any prioritization question they throw at you.
Okay, let's step back for a minute, because this is about so much more than just passing one exam. This is about shaping the way you think for your entire career.
You know the CJMM, this whole 6-step process, it's not a test-taking gimmick. It's the actual mental map that experienced, expert nurses use every single day. It's what gives them the confidence to walk into any room, assess a situation quickly, and make the right call. It's how you prevent problems before they become catastrophes.
So, I want to leave you with this question. The next time you're in a clinical setting, or even just working through a practice question, ask yourself, am I just collecting data, or am I recognizing the cues that truly matter? Because training your brain to do the latter, well, that's what it really means to think like a nurse.